At the Garden Gate Healthcare Facility, a new complex medical care unit is opening that will provide patients with 24/7 non-invasive monitoring of their cardiac performance. This is the only unit like this here in Western New York. Now, Jim Maguire is the CEO of the Maguire Group, and he is here with Dr. Ray Ogra, who is the attending physician. Jim, why was it important to bring this to Garden Gate?
We've been very proud of our level of quality, being the highest quality operator in New York State. This is an opportunity to increase that level of clinical sophistication and continually demonstrate our value to our patients and to the healthcare system to really remain relevant and help revolutionize how patients are treated.
Do a lot of patients present with cardiac problems, so you find this very necessary?
Many problems present with cardiac problems. In fact, the incidence here in the Western New York area is increasing, especially with our elderly population, and more of them are traditionally needing rehab services to get back to their baseline status.
Here we're in the therapy room where people are having their hearts monitored as they're actually performing exercise, but there's also a unit with beds. Why did you allot so much room to it? I mean, obviously you really care about this and you want to make sure it's completely thorough.
But we want an increasing number of patients to have this technology available, and we want them to be able to go throughout the building and use any of our services while still maintaining that monitoring and close watchful eye of the clinical staff. It's a level of care and level of clinical quality that they can't get anywhere else, and we're going to continue to roll that out in our other facilities to be a differentiator versus our competition.
Traditionally, what we do when we do rehabilitative care is we're using our eyes, our ears as clinicians. We're looking at their breathing. We're checking their blood pressure. At times we can check their heart rate. I mean, very traditional things. But oftentimes when patients are not having the best performance that they can, you're not really sure as a therapist where exactly you're going wrong. Sometimes you have to just stop therapy. You have to get them back to the room. You can lose half a day. You can lose a whole day. Sometimes actually things go to the point where we feel like we are not comfortable with sending them back to the hospital. So by having the monitors that you're seeing on the screen, we're actually able to have hospital level, and in some cases even beyond hospital level types of monitoring, where we're able to figure out kind of in real time what's going on. When people are going from sitting to standing, for example, laying down to standing up, there's many physiological changes that happen, and the monitors give us basically a window as to what we need to see. So we can see, for example, if someone's dizzy, maybe the blood pressure's too high, maybe low, maybe the heart rate's high, maybe the heart rate's low. And rather than the people in the emergency department trying to figure out what's going on, we can pretty much do it right here, get them taken care of. If there's something medical that we can't handle here, obviously we'll get them to the hospital.
Right.
But if it's something relatively straightforward, needs an adjustment in their medications, needs something that maybe our therapists need to do, some type of education in terms of how far we're advancing their therapy, maybe taking it easy that day, we can do it all right here.
Yeah. In the CMCU unit itself, you have telemetry, which means you can actually show a patient's vitals and all their information to a doctor that's not here, at a hospital.
That's correct. We actually have an app on our phones and also on our iPads and computers. We're actually able to tap into all this information remotely. So if we're working with a cardiologist, for example, that we have on staff, we're able to communicate instead of Mike just trying to describe it, able to send that information through a fax machine, which we used to do for, say, EKGs. We're able to actually speak at the screen at the real time, which is very helpful.
Yeah.
Then the cardiologist can give us real information, not only during our daytime, sometimes we're doing this in the middle of the night. So if a patient were to wake up in the middle of the night and not feel well, maybe they have chest pain, maybe they're dizzy, we're able to all work together as a team and get that taken care of.
Let me just get back to you for a second. This was exciting for you to be able to do this. What do you want people to know about this unit?
I think just it's a continual evolution, and we are always striving to be at the forefront of our field and to offer the best possible care to patients. As technology becomes available, we continue to invest in those things and maintain our position as the highest quality, best outcomes, best for the patient, and really most efficient for the healthcare system.
And if people have questions, feel free to call, right?
Yes, thank you.
Or log on as well. We're talking about the Garden Gate Healthcare Facility, where they've now put in the CMCU unit, and it's going to be remarkable for those who have cardiac issues. By all means, if you would like to know more, do call or log on today. I was amazed at what they were doing with the telemetry. They were able to get a doctor right there to be able to speak to the patient, and I'm telling you, it saves a lot of time and you get that care instantaneously, so they're amazing.